Hello everyone, welcome back to Rapid Review for MRCEM. We are going to cover a topic on trauma. I've got Sam with me who is going to appear for MRCEM exam next month. So we'll start with the case. So Sam, are you ready?
Yep.
Okay. We have got a 45-year-old male patient who presented to the emergency department after a high-speed motor vehicle collision. On examination, he has tenderness over the right side of his chest with palpable crepitus and paradoxical movement of a segment of chest wall during respiration. His oxygen saturation on room air is 89%. So the question is, what is the most appropriate immediate management for this patient?
Okay, so from the story, I'm a little bit worried, particularly because he's had an accident, but with the paradoxical movement of his chest and some tenderness over that area, I'm wondering if he's potentially got a flail segment, and with crepitus, potentially a pneumothorax.
Okay.
And his SATs are 89%. Okay, so option A, start high flow humidified oxygen therapy. With somebody who's got SATs of 89%, I probably would want to do this, so this is definitely going to be an option.
And correct. If we follow the ABCD protocol here, we are not worried about the airway. So the next is breathing. With the breathing, you have to always start with giving high flow oxygen. So correct. So this may be the correct option, but let's go through the rest of the options.
Okay. Perform an urgent chest x-ray to confirm diagnosis. He will end up either having a chest x-ray or potentially, or more likely, a CT. So this is an option, but I don't think it's quite as immediate as the oxygen therapy that we saw in option A.
Yeah, I agree actually. So we should not stop the treatment just while waiting for the diagnostic imaging. So this is not the correct answer. I agree.
Administer IV fluids. At this point, I don't necessarily have an indication for this, and this is coming, even if it is necessary, C becomes after B, and I'm not convinced.
Correct, I agree with you. In trauma patients, we have to be careful with the IV fluid administration because excessive IV fluid can cause pulmonary edema, fluid overload. If you go with the NICE guidelines, it says very clearly people can be given up to 1 liter of crystalloid pre-hospital, but in hospital, if they are needing some fluid administration, it needs to be blood because most of the time hypotension is secondary to bleeding somewhere else.
D, intubate, initiate mechanical ventilation. At the moment, I don't have an indication to do this. Although his SATs are a little bit low, they're not that concerning that I think he needs to be tubed, and he does seem to be able to breathe, ventilate himself. So I don't think it's D.
Correct. Yeah, I agree. Good.
And option E, intercostal nerve block. Potentially he may need this at some point. However, in terms of the most immediate management, this is going to come lower down my list, so it's not E. So I'm going to go overall for A.
Very good. And as we discussed in our previous episode, we have to look at the wording of the question. The question, as you said, it suggests immediate management for this patient. So you are correct. The immediate management is starting them on the high flow oxygen therapy. Well done. Good.
Thank you.
Thank you. Thanks for watching, and I will see you in the next video.